Welcome to Hope Matters, a production of Mount Olive Lutheran Church here in Santa Monica, California. I'm Pastor Shafer, the senior pastor here at Mount Olive, and this is our weekly program where we talk to interesting people from around the community and around the nation, even around the world, about the theme of hope, because we believe that hope matters. My guest today is the Reverend Kathie Bender-Schwich, who is the Chief Spiritual Officer. Kathie, I just love that title, Chief Spiritual Officer of the Advocate Aurora Health Systems. So we certainly want to unpack both of those things for our viewers. So let's start with the health system. The Advocate Aurora Health Systems is a whole bunch of hospitals, isn't it?
That's correct, Eric. It's about 27 hospitals in parts of Wisconsin, as well as the greater Chicagoland area of Illinois. Advocate Aurora was created about 3 years ago with the merger of Advocate Healthcare in Illinois and Aurora Healthcare in Wisconsin. So we have 75,000 employees across 27 hospitals, about 500 outpatient sites of care. So quite a big health system, one of the 10th largest in the country.
That's right. But you got your start in what used to be called Lutheran General Hospital, right?
That's correct. That's correct. Lutheran General in Park Ridge, which is affiliated with the ELCA, formerly the ALC, but it's affiliated with the ELCA, and it became part of Advocate Healthcare in 1995. And Advocate Healthcare was a merger of Lutheran General Health System out of the Lutheran Church and Evangelical Health System out of the United Church of Christ. So the Advocate side of our current health system still maintains its faith-based affiliation, which is why my role exists.
Yes, tell us about what it means to be a Chief Spiritual Officer, besides just a wonderful title.
Yes, it's a wonderful title. And if you Google it, I don't think any others come up. So I'm kind of it. But what it entails is maintaining that faith-based affiliation with our two sponsoring denominations, if you will. But I also oversee our spiritual care services, so all of our chaplains throughout the system, as well as our clinical pastoral education program. We're the largest CPE program in the country. I also oversee all of our ethics services, as well as our environmental sustainability program. So all of our green initiatives, green buildings, reducing our carbon footprint, that kind of thing, as well as our trauma recovery center. And since the onset of COVID, I've had the privilege of leading our well-being efforts for our physicians, nurses, and clinicians and other team members throughout the system.
Wow, what are you doing in your spare time, Kathie? There you go. So I love it that they put the environment under the Chief Spiritual Officer. I mean, that, did you advocate for that, or did that just come your way?
Somewhat, but it was seen as a natural fit. Prior to our merger with Aurora, my title was Senior Vice President for Mission and Spiritual Care. So it really, everything I do kind of fits in with our mission as an organization in environmental sustainability, care of God's creation, just really fit naturally with that sense of mission of our organization.
Wonderful, wonderful. Well, there are lots of directions we could go with this interview. So how many chaplains do you have on staff in the system?
We have about 95 people. Those aren't all full-time positions, but we have about 95 people serving in chaplain roles in some form or another. And also, as part of our commitment to the spiritual well-being of our patients, our the family members, and all of our team members, each of our patient service areas, which are like regions, has a vice president of mission and spiritual care that reports to the executive leadership teams of those hospitals, just as I am on the executive leadership team of the health system and report to our CEO.
So how's it gone in COVID for your staff, especially?
It has been, as you can well imagine, a challenge, and that's not unique to us. We hear across the country of hospitals and health systems just being maxed out and overburdened. Our chaplains are doing amazing work at certainly caring for our patients, especially when they couldn't have visitors and so on, making sure they stayed connected to family. but really caring for our team members, our nurses, our physicians, and so on, who are just, at the beginning of COVID, we thought, okay, this is a sprint. We'll give 200% and get through it, and then it will be over. Well, we're in almost year 2 of it, and we're in the midst. Our numbers are as high now as they've been in any part of 2021 as far as COVID inpatients. So we're getting maxed out again, and people are realizing this is a marathon and they don't know where the finish line is.
That's right.
So really calling on all their reserves to get through it.
That's right. I should tell our viewers that Pastor Bender-Schwich and I go back
Many years.
More than 25. Yeah,
right.
More than 25. Right. So before she served in this position, Kathie was the executive assistant to the presiding bishop and the staff person for the ELCA Conference of Bishops, among other responsibilities in her life. And we've known each other for quite a while. And I was even at your wedding, as I remember.
That's right.
So there
That's
we were. Yes. So some years ago. What are the other challenges? I know you can't put COVID aside by any means, but looking at the healthcare system, especially from the spiritual, what are some of the other challenges that you see in your work?
Putting COVID aside,
which is difficult.
That's right. It's helping our chaplains understand how healthcare is changing. Back when I went through clinical pastoral education, is probably when you did too, Eric, it was, patients who went in for an appendectomy were in the hospital for 10 days and everything. Now, a lot of that is outpatient surgery. Yeah. So how do they connect to patients? Most of our inpatients, other than COVID, are the ones that are there for a long time are really, really, really sick. So it's really upping the ante on the kind of care they're providing in the acute care setting, but then also how do chaplains serve in outpatient settings, and in cancer infusion centers and different things like that. So helping chaplains rethink about what their role is. It's still very important, but how it goes from just being in the hospital to being in other areas, and how we partner with our faith communities in that way as well.
Oh, that's right. Now, on your staff of these 90 some people that work in the area, I assume you have many religious faiths represented.
Yes. And that's something that we're really blessed to have, is a variety of faith traditions represented. But again, because they are all trained professional chaplains, they realize that they're there to serve and care for people of any faith tradition or no faith tradition who just want a supportive spiritual guide there with them in their journey when it's a very difficult situation as they're dealing with illness and so on. Something else that we developed recently, we got it started before COVID, but really ramped it up during COVID, is what we call Chaplain Connect, where we have one of our chaplains available by phone 24/7. So anybody, a patient who's lying awake at night and lonely or concerned, a staff member who's stressed out can pick up the phone, dial a number, get a live chaplain on the other end to talk with them through things.
That's wonderful. I would think for staff members, especially in these times, it must be a very big help.
Yes. And our plan is to eventually implement this where if I want to fill out an advance directive or plans for my end of life and want to have a conversation with someone, I can make an appointment and talk to a chaplain on the phone to discuss and walk through that as well. Because while our physicians really want to have those conversations with patients, they don't always have the time. So the physician can start the conversation and then encourage the patient to call and talk to the chaplain to get more questions answered.
It would be a huge help to have that, dealing with as you did when you were a congregation pastor, with people that don't have anything, and then it becomes a real issue. And
That's right.
And I have a lady now who really wants to die, and there's no DNR, and there's no way to get one, and so it's just the nursing home is caught at that point. But she's the one that's really caught, because she'd rather be with God, not here. So. Yeah, it's a real challenge.
Tough.
Real challenge. So with all of this, Kathie, and through COVID and everything else, where do you find hope in your life and ministry?
Great question. And I've heard some of your other guests answer it, and I resonate with them. I think on the micro level, in the midst of all that we're dealing with, and I mean, part of our health system is located in Kenosha, and we know what's happened there with the Rittenhouse trial. Also in Waukesha, where the tragic accident happened, where a car plowed into people watching a parade. All of the stresses and all of that we're under, people are able to find their own meaning and purpose in what they're doing and saying, yes, I'm here to care for this patient at this moment. I'm, as a chaplain, here to respond to this person's spiritual needs at this moment. It's the personal one-on-one interactions, in a sense of, even with all the craziness going on around us, I personally can make a difference in my own small way. And that brings me hope that there are many, many people doing that. Our future generations, I mean, I have children in their early 30s, late 20s who say, I still see where I can make a difference in the world. That brings me hope. And on the macro level, just hope in knowing that there's a God who's in charge and it's not me. So that, we rely that God does have the whole world in God's hands, and God has not given up on us.
Wow. Excellent. 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 Thank you so much for being with us on Hope Matters today. I really appreciate it. It's always good. It's always good to see you too, even through the lens of YouTube. So
it's been great to see you, Eric, and great to be with you. Thanks so much for the opportunity.
You're welcome. This has been Hope Matters, a production of Mount Olive Lutheran Church here in Santa Monica, California. I'm Pastor Eric Shafer, the host of Hope Matters. Our guest today has been the Reverend Kathie Bender-Schwich, who is the Chief Spiritual Officer of the Advocate Aurora Health Systems in Illinois and Wisconsin. And what a pleasure to be with you, Kathie, today. Tune in again next week for another episode of Hope Matters, where we talk with an interesting person about the theme of hope. We believe that hope matters, and we believe in a God of hope.